Welcome, everyone. And we're very happy that everybody could join us today. We're calling this the COVID Chronicles. So we're going to talk a little bit each week, for at least for the next 3 weeks, about what is happening with COVID in our country, because it's definitely a changing landscape. And today, the subject is going to be Omicron versus Delta.
So welcome everyone. At the beginning here, we just want to take a moment to tell you who we are. Some of you know us and have seen us quite a bit in this little online forum, and many people might be new to us. So I am Dr. Laura Stuve. I am a PhD molecular biologist, molecular geneticist. I do have a background in virology from my scientific career, and Janet and I are the co-creators of the body intuitive system of mind-body medicine. And we're going to tell you about our observations clinically with COVID-19 and just get you up to date and try to answer your questions.
And I'm Dr. Janet Gallipo, Doctor of Oriental Medicine. And Dr. Laura and I have really been treating COVID from the front lines since the beginning. So it's been almost 2 years now. And so we have addressed lots of acute cases of COVID, lots of chronic cases of COVID, lots of long haulers COVID, lots of Delta, lots of all of the different, derivations of COVID. And so we want to talk to you today about what we see with the new emerging COVID trends.
And there's some people that are chatting in, wondering if there will be a recording. Absolutely. This is recorded. You can watch the recording. You can share the recording. So this is designed just as kind of like a public health informational forum. And the intent of this free lecture series is to update you on our observations and the ever-changing science of COVID-19. So as a scientist, I'm pretty convinced that one could spend their entire day, every day right now, just reading about the latest science of COVID, the variants, the various treatments, the vaccinations. There is so much information we're being flooded with. A lot of it is misinformation. And so sorting through what's real, what's not real can be complicated to really make the safest, best decisions for you and your family. And the other thing that's changing is it's not the same virus as it was in February 2020, or the same virus that was here in July 2021. We have the same pathogen, but slightly different. And we're going to talk about why these distinctions are important. Okay. And you're more than welcome to chat in or ask questions, and Janet and I will grab all of those at the end.
Yes. So basically, our focus for starting, of course, in 2020, we began in March when all of us learned about this pandemic, really worked for all of 2020, worked all last year, 2021, and of course, now we're into 2022. And so we really have been very actively involved in working with all types of COVID, all stages of COVID. What did we do? Well, we developed east-west distance protocols for addressing COVID-19, right? So we call this, our version of telemedicine in order to address COVID-19. And we have done hundreds of acute and chronic long hauler case studies, and, really kept track of what we have been doing. And we're also in the process of updating our protocols, because now it's January of 2022. And as Laura says, it's a new COVID, right? So it's the same pathogen, but there have been changes. And so we need to update our protocols to stay current with the new COVID. We also introduced a COVID-19 vaccine reset protocol, both pre-vaccine as well as post-vaccine. And we felt that we needed to do this because, there is so much vaccine resistance. And of course, we know that we're in the middle of a global health crisis, and that it was important to have something to help people feel secure so that if they had the vaccine, that they weren't going to have any excessive side effects. So we've been working with this COVID-19 vaccine reset, and it is in the process of being updated this month for Omicron. And then we developed the Elemental Reset course because we thought, okay, well, we have to have some kind of a support system for everyone. Like, what can they do to keep their immune system strong? What can they do specifically to work with this ongoing COVID crisis? And so we developed these 5-element resets that really help to strengthen the immune system, strengthen the Wei Qi system, and we have weekly community support practicals for these resets.
So we're going to start with a little bit of updates on the science. I'm going to compare and contrast what's different with Omicron than Delta in terms of how infectious this is. And as Janet said, it's a new COVID today. So Omicron is about at least twice as infectious as Delta, which was at least twice as infectious as the previous variant, the Beta variant. So that the virus is becoming more infectious. And what does that mean? That means any given person that has COVID, asymptomatic, mild symptoms, or severe symptoms, gives it to more people. And some of the epidemiologists and virus experts are really coming out now, and they're saying that Omicron is the most infectious virus that they have ever seen. So it's even more infectious than measles, which was the previous winner in that department. Okay. The other thing to know is as the surface of the virus, what the immune system sees, either if you get exposed to the virus or the virus is inside your body, is different enough with Omicron than Delta, so that if you've had COVID before, or if you've received a set of vaccinations for COVID, the antibody protections don't quite offer complete protection in many people. So there's this whole set of what are called breakthrough cases, people that should have immunity but are still getting sick. And the data that is out right now that says if you've had COVID before, the Delta strain, the Beta strain at some other point in the pandemic, you're 10 times more likely to get COVID again with Omicron than you were with Delta. So we had more antibody protection to Delta than we do for Omicron. So this is antibody protection. It turns out what is saving people from severe illness in Omicron, either people that have been vaccinated or have had COVID before, is the T cell immunity. And it's just a different layer of immunity in your body. And I've seen many analogies for what the vaccinations are doing to prevent serious illness. And one of them that I like is the seatbelt analogy, seatbelt or airbags. So it's not like there are no people that get seriously injured when they're in a car accident wearing a seatbelt or in a car with airbags. So those safety measures are not 100% effective, but if we took them away, there's a huge difference between no seatbelts, no airbags, and with seatbelts and airbags. And that's about the same thing that you see with vaccinations. So some of the people that are really characterizing the fine distinctions of previous protection again, by some combination of vaccinations or COVID. If you're doubly vaccinated and boosted, or doubly vaccinated and had COVID, 3 exposures of your immune system to the virus, the general tendency, unless you have a lot of pre-existing conditions, is there's no symptoms or your symptoms are very light. Those T cells and some of your antibodies are offering protection. If you're doubly vaccinated or singly vaccinated and have COVID, basically your immune system has seen COVID twice. You get a sore throat and sometimes a pretty serious flu. Okay. Omicron being called mild, many clinicians are actually questioning that. And Dr. Janet is really going to take us into the is this mild conversation in a moment. Whereas the people that we're seeing that are in the hospital, that have never had COVID before and are unvaccinated, so no prior exposure to COVID, they get a more serious illness. All right, so this is infectivity and a bit on severity. So the science of the milder Omicron, why is Omicron milder? Obviously, there's changes in this variant in the sequence of the genome of the virus. So it's a slightly different SARS-CoV-2 virus. And one of the reasons why there is milder global symptomology is because many are already partially protected. Again, we just talked about that, having COVID before, being vaccinated, or some combination thereof. Another reason why it is milder is because it doesn't go to the lungs the way Delta does. It really, the primary infection is in the throat. So there's a lot of sore throats, but it's not causing the acute respiratory distress and inability to breathe that was putting people on ventilators. There are still severe infections and hospitalizations, but those were higher with Delta. Okay. Although more kids are seriously impacted by Omicron. Right. And I want to point out that now there are statistics from South Africa, the UK, and the US that shows that based on the number of infections and how many of those people end up, so serious that they have to go to the hospital, the hospitalization rates are 25 to 50% lower, depending on the country. So less people that get COVID get hospitalized. But the sheer numbers of people with Omicron have caused the highest hospitalization rates that we've seen in the US since the beginning of the pandemic. So hospitalization rates are extreme, but they would be worse if Omicron was as bad as Delta. So Dr. Janet is now going to take us through the Delta versus Omicron. I call it her observations from the front lines of treatment. Dr. Janet is doing many COVID sessions on a daily basis.
Yes, it's true. And every morning I get up and I have to see, who's texted me overnight, who has sent emails, who's in some kind of a COVID crisis, because obviously lots and lots of people have Omicron now and are looking for some way to address it. So what I have noticed from a Chinese medicine standpoint in treating Omicron is that the pattern of physical symptoms is different. So as Dr. Laura said, there are less severe respiratory symptoms. So we know with the original COVID and also with Delta, that things went straight to the lungs, right? And then we would see these serious situations developing, including, lots of hospitalizations, lots of, intubations, lots of acute respiratory distress syndrome developing. So as she mentioned, now there are less severe respiratory symptoms. However, that is not to say that Omicron is not affecting us. So what I am observing as far as acute symptoms is more headache, more fatigue, a lot of joint pain, and then two very interesting symptoms that really were not that common with original COVID or Delta, which include a lot of low back pain and night sweats. Okay, so why are we seeing these strange symptoms? Because according to Chinese medicine, it's water element time. And the spotlight is on the kidney systems. And the kidney system really rules the low back and also the hormonal balance in the body. And so the weakness and the strain on the kidney system during Omicron is creating these symptoms of low back pain and also night sweat. So in terms of the numbers of patients that I'm seeing with this, I would say that this list of symptoms is typical for 80% of the patients that I am treating and students are treating. And so we just have, so the Delta versus Omicron, if you look at the bottom here, so as far as its impact on lung qi, what I'm saying is that Delta impacted lung qi sort of 70%, meaning that was the system of the body that really took the majority of the hit from Delta. And Omicron, it's down to 30%. The digestive system with Delta was not so acute, right? 20%, a little bit less, but we are seeing more digestive system complaints with Omicron. It's up to about 40%. And then again, the kidney system is being impacted. It was not being impacted very much with Delta, but it is being more significantly impacted. And this is our source chi, this is our energy reserves. And so I'm estimating that the impact there is about 30%. So why is it different? So as I mentioned, in Chinese medicine, the time of year and the prevailing climatic factors during the time of year are very, very important. And in Chinese medicine, in order to understand the nature of pathogens and the way that pathogens spread, they look at when did the pathogen emerge or when did the variant emerge. So we might remember that with the original COVID, originally in Wuhan, it was emerging in the late fall of 2019, right? We weren't aware of that. That was metal element time. And of course, metal element time has to do with the lungs. Then we saw the Delta variant this last year in 2021 that emerged during late summer, which is earth element time, lots of damp substance. And also into metal element time. So that's when the majority of a Delta was happening, right? Late summer and fall. And so again, that has to do with the systems of the body that are affected. Now, Omicron is emerging smack in water element time. So as a result, according to Chinese medicine and the way the Chinese view pandemics, we are seeing different symptoms. So looking a little bit more about what we're talking about here. Yes, so original Delta was what we called, and original COVID and Delta is what we call a mixed yin pathogen. So what we saw is yin substances, which is a combination of cold, cold weather, cold temperatures, along with dampness. And then we also had a combination of wind and heat because the pandemic has gone on for so long that it's really picked up a kind of mixed bag of different factors. So we have cold, we have damp, we have wind, and we have heat, all combining. And when we see this, it settles into what we call the Xiaoyang level. Xiaoyang level is something very, very particular in Chinese medicine, but like a super kind of interesting concept where basically people get on and off symptoms. So they get COVID and it seems, intense or acute, and then they get a little bit better, but then they start noticing long COVID. They start noticing that COVID's actually affecting different areas of their body, right? So maybe their sense of taste and smell has been impacted and it hasn't come back, which really indicates not only mental element imbalance, but neurological involvement, or maybe, they're just feeling more exhausted, or maybe they're feeling, they have a lingering cough, or maybe, other kinds of symptoms that seem to come and go, like their sleep is fine one night and not fine the other night. So when we see this, we know that different systems of the body have been impacted. And here we're really talking about the original COVID and then the Delta variant that gets stuck at what we call this Xiaoyang level. Omicron is a little bit different. So we basically say that because it's a yin pathogen, it is affecting yin areas of the body. So yin areas of the body include the digestive system, the spleen, and also, as we mentioned, the kidneys.
I'm going to bring up an issue that has been up a lot in the news, in social media, and there's many people just kind of with an attitude of, let's just get it over with. Let's just all get Omicron. Let's get to global herd immunity more quickly and kind of like be out of the pandemic. And so we're going to consider some reasons why you don't want Omicron. And this, that I read an article about this pretty much every day. So I'm just giving you what are the latest views of this and what are my observations from working on people's epigenetic damage from having COVID. So even if you get mild, like cold flu, like Omicron, the observation is you can still get long COVID. Nobody wants long COVID. Nobody wants symptoms of exhaustion, inflammation, brain fog, neurological impacts, digestive impacts, et cetera, that last for months. And they are now finding that even in people that had very mild COVID symptoms, some of them develop autoantibodies. What are autoantibodies? Those turn into autoimmune disease if you play that forward months or years. So you don't want a predisposing autoimmune disease condition. When there's autoantibodies or just COVID recovery, my observation from working with a lot of COVID recovery sessions is people have elevated inflammation, even young people that did not get very sick. Elevated inflammation can impact any system of the body. It can impact your brain function, your digestion. It could cause aches and pains anywhere. And it is going to increase your risk of chronic disease in a year, in 5 years, in 10 years. The other observation that Janet and I have had for a while is when we work with people that have serious COVID, is we always have to work on their pancreas. And science has now started to identify that many people with COVID-19 all of a sudden develop diabetes. And this is now, there's data coming out that this even happens in children. And in children, the observation is that it's not just type 2 diabetes, it can be type 1 diabetes, the autoimmune diabetes, where your immune system attacks your pancreatic islet cells and you are insulin dependent for the whole rest of your life. So this is a lifelong serious risk, and you don't want to do anything that elevates that risk from my perspective. And then, as Janet said, loss of taste and smell, still common with Omicron. That indicates neurological involvement, and some people find this persists for months. So, what I have observed in working with people with COVID-19 for a while is that these imbalances, whether or not they have long COVID or not, there are changes in their body epigenetically down on the code on top of the DNA that lock in imbalances, sometimes in the pancreas, sometimes in the liver, sometimes in the brain and nervous system, sometimes in the digestive tract. Very often, the primary system that gets impacted and is not the same post-COVID is your immune system. So this elevated inflammation is kind of stuck. It's locked in. Okay, so these are relating to your personal health, the top 3 reasons. The other thing is you want to protect our healthcare systems that are already maxed out. The hospitals are full, the ICUs are full, less people need to go to the hospital and need to go to the ICU, but the numbers are so extreme. Hospital systems, in Europe, in Canada, in the US are maxing out now. I'm sure in other countries as well. It's just, I don't see that data as much. And then you're not a carrier if you don't have Omicron. And so it is a way you protect more vulnerable people that maybe have had COVID or been vaccinated, but they're still older and they have pre-existing conditions and they're at elevated risk for hospitalization and serious disease. And also young children that are not protected. Okay, so those are reasons why you might not want Omicron. And then the last thing that I want to share is, okay, we're all done with this pandemic. Everyone is tired of it and the impact on their lives and their health and their businesses and their family and their friendships. And so when is it going to end? Are there going to be more variants? There's many, many predictions by experts in many fields. And basically, even the experts say that this virus has mystified them at every turn. No one saw Delta around the corner. No one saw Omicron. And so what do we know? Okay, we know that there are millions of people around the planet that have Omicron and Delta. Delta is still out there in reasonable numbers. So new variants of this virus, the SARS-CoV-2 virus, will continue to emerge. Why is that? Well, basically the what's called the naive population, the population of people with no immunity, which is the unvaccinated population, fuels the emergence of new variants because there's areas where a lot of people can get the disease. This second piece is a big one for me, understanding a bit of the biology. Since there's multiple variants, specifically Delta and Omicron right now, people can get co-infected with Delta and Omicron at the same time. Both viruses are in your body, inside your cells, in the same cells, replicating and dividing. And one thing that can happen then is essentially the viruses can recombine or mix and match to form a new hybrid virus that's part Delta and part Omicron. So we know Delta causes more serious, rates of hospitalization and death, and Omicron is very infectious. The worst case combination there of those two would be bad. So the thing to know is over the last few days, this Deltacron, people that have created this new hybrid virus in their bodies, part Delta, part Omicron, is here now. And there could be many different types of Deltacrons because there could be many people with both Delta and Omicron. They haven't fully characterized the biology of this virus, but this kind of scary scenario is here at the moment. So if we look forward in terms of what the future holds, in general, virologists are optimistic. Omicron might be the beginning of the end or the end of the beginning. There are enough people that have immunity at some level. It's possible there will be no more variants of concern. Whereas the worst case scenario is we're only about halfway through. There's going to be another couple years of the variant of the month club. And some of them are going to be milder and not be an issue, but there's the possibility that of, recombining viruses that have deadly characteristics that could show up at any point. And so the future is unknown. Janet and I want to share, given everything that is going on, what are our recommendations to be safe and sane? Okay, so Dr. Janet is going to highlight some of these here.
Right. So obviously, taking precautions to protect yourself and your families. We're calling it Be Smart. Yes, wear masks. And, the type of mask really depends on your preference. But, what they're saying now is that the KN95 or, similar masks probably protect better than cloth masks. I know that I had to fly recently and I wore a 2 KN95 mask to take them off the whole time, which presumably was providing 10 levels of protection anyway. I did what I could. Respect social distancing. Of course, we know that we're all absolutely tired of this. We're tired of not seeing our friends. We're tired of not seeing our families. We're tired of not being able to have a normal life. But we still have to respect that there is a very dangerous and contagious variant out there. And it is continuing to affect lots of people, especially the vulnerable. So trying to maintain social distancing is important. And also, spending time, waiting waiting a few weeks to re-engage in social activities. It's important to respect that. Also, in terms of what you can do actively to help keep your surface level immune system strong, we're recommending energetic practices. We have the whole concept of Wei Qi in Chinese medicine. That's a protective shield around your immune system. And the things that really help to shore up your Wei Qi are acupuncture, body intuitive sessions, and also doing the elemental reset. They help to keep the Wei Qi strong. And I spoke recently in a class a few days ago about the fact that people who are getting regular body intuitive sessions were actually sleeping in the same bed with their spouse who had COVID, and they did not get it. Yes, so as we said, we're going to do this next week. So we look forward to seeing you same time, same place, January 18th. And we're going to answer some questions now. But we thank you very much for joining us today, for listening. And please share with anyone in your community who you think might be interested. You're going to receive a recording, and please feel free to pass that along and share with others. Thank you so much, everyone. Thank you for joining. And we will look forward to seeing you next week.
Yes. Thank you so much.